Separating the fact from the fiction when it comes to COVID-19 and the surge that we are seeing right now. Dr. Ruth Berggren, an infectious disease specialist from the Long School of Medicine at UT Health San Antonio, joins us now, as she does every week, most weeks. Thank you, Dr. Berggren, for being with us. I know that you did a round on the infectious disease patients today, but you also are in constant contact with the people who are on the COVID floor. What are they telling you about the situation right now?
Well, the message from my colleagues that are rounding on the COVID patients today is please get vaccinated. They're really, really heartbroken about some of the cases that they're taking care of, particularly a couple of pregnant women that we've had who've needed to get on heart-lung bypass machines, what we call ECMO. And this is just devastating to watch, and we know that it's preventable. I spoke to one of my internal medicine colleagues who said that 4 out of 15 patients on her, it was more than half of her patients were COVID, and that she had heard about a family situation where the father had died, leaving his spouse who got COVID and then had no help and was injured in a fall, and then one of their adult child got COVID and was hospitalized. And so it's really devastating whole families. And the vaccine works. The vaccine prevents hospitalization and death. And we wish everybody would get it.
In the city and county briefing today, we heard about more pediatric hospitalizations, and that's a huge concern for so many families and parents, especially right now with some kids heading back to school in the coming days. So what can you tell us about cases in children in the hospital that your colleagues are seeing?
Certainly, we're seeing much more in COVID in the pediatric population. I want to emphasize that the risk for a child getting deathly ill with COVID is really low. I don't want people to feel terrified, but we have no way of predicting who's going to get really sick and who is not. So until we can get our kids vaccinated, masking is really, really important right now. It's not that much of an inconvenience to wear your mask and teach kids to wear their masks until we can get people vaccinated.
I know that with the going back to school, a lot of healthcare workers have said, we're bracing for higher numbers because of that, not only with kids, but of course teachers and other school staff. So are we seeing an increase with more people in close quarters? Has there been an impact from that yet that you're seeing?
Well, so, we've been surging now for the last 2 weeks or so, and we seem to be reaching a peak that's pretty close to our all-time high. It seems to maybe be faltering a little bit at this level, but of course, school just started for most school districts, and we don't know where it's going to go from here. So these curves do flatten down, but they don't do so out of some sort of magical thing that happens or of the virus suddenly changing. These curves of virus outbreak, they come down when people change their behavior. So it's all up to us. If we can manage to get people to mask and keep their distance and get vaccinated, we can help bring these curves down instead of seeing them continuing to go up and up and up.
A lot of talk about booster shots. Your advice for people in general, and especially if you have Pfizer or Moderna, I think that there's still data to be covered when it comes to Johnson & Johnson, but your advice for people when it comes to booster shots?
So I just want to use the term third dose, which is being recommended. We're calling it a third dose rather than a booster. And let's start with people who are immunocompromised. It's very clear that those people, like solid organ transplant patients, chemotherapy patients, they have a much higher risk of breakthrough right now and a higher risk of getting really ill and going to the hospital. So they are the people that we are focusing on first. We are asking them to get their third dose, to stick with Pfizer if they had Pfizer, and stick with Moderna if they had Moderna. And it needs to be at least 28 days after your second dose that you get your third dose. So that's really the emphasis at the moment. Of course, everyone has heard that there's now a recommendation that everybody else is going to get a third dose starting September 20th. And I want to emphasize that you shouldn't rush out and jump the gun and get get that dose before September 20th, notice how quickly the recommendations keep changing. September 20th is still a whole month away. And it will get rolled out gradually, and we'll be focusing on nursing home residents, very elderly people, healthcare, and frontline workers, just as we did when the initial vaccine was first rolled out.
You know, we talked a little bit about your colleagues and what they are seeing, and I know that we have covered here how healthcare workers, they have been the subject of frustration, the target of frustration for some families, who were going through a really tough time. What are your colleagues dealing with in the hospital? How are they handling these situations where, like you said, pregnant women are very, very sick and in, horrible situations because they're unvaccinated?
Yeah, this is really hard. This is the third big surge, and it's almost as high as it was at the highest level. And people are tired. They're frustrated, and some of them feel really despairing. And they wrestle with emotions, knowing that some of these tragedies could really be prevented. But all of us need to stay strong. We need to stay committed. We need to remember our calling and just be kind and compassionate and non-judgmental. It really helps to dig in and find a non-judgmental stance, because that helps you just connect to why you're a healer in the first place. And we can do this, but we need to be compassionate for our patients, and also compassionate towards ourselves.
Dr. Ruth Berggren with the UT Health SA Long School of Medicine. Always appreciate your time. Thank you.
Thank you.